So today I'm going to be talking about undescended testicle. You see, the testicles are formed on the inside in boys, and they travel down. They carry their own blood supply all the way down into the testicle during when the baby is still in the womb. And sometimes it actually takes a few months, especially in premature kids, for the testicle to find their way down into the scrotum, but which is the sac. But sometimes this doesn't happen, and so usually after 6 months of age, if the testicle is not down in the scrotum, there are a couple of things, well, three things specifically that we worry about. One is the fact that the testicle being up in the abdomen, in the abdominal cavity, can increase the chances of cancer in that testicle. And so bringing it down helps to make it easier to be able to evaluate the testicles. The other thing that we worry about with testicles being higher up is the fertility and whether or not there is a decrease in fertility given the heat of the abdominal cavity. It's very difficult to say really from a fertility standpoint because fertility is very personal. The third thing is that because the testicle is not fixed down into the scrotum, into the ball, into the sac, we worry about it twisting on itself and in a process called torsion. And if that happens, if the testicle twists on itself and loses its blood supply, there's a risk of actually losing the entire testicle in the process. So to manage this, when we have a baby or a child that is older than 6 months and the testicle is not down in the scrotum, what we do is surgically, we do a surgery to fix it down into the scrotum. And the extent of the surgery will be determined by how high up the testicle is. So if the testicle is still inside the belly, for example, we would have to do a surgery that involves going into the belly, into the abdomen, finding the testicle and breaking it down. That can be done in a single stage or in two stages, about 6 months apart. But if the testicle is found in the groin or just kind of high up, then we might be able to do the surgery either by making an incision in the groin or just by making an incision in the scrotum and then fixing it down into the scrotum. So if your child does not have you should check, when you bathe for your son to make sure that both testicles are down and in the scrotum, which is in the bag, in the sac. If it's not there and your child is older than 6 months, you really want your pediatrician to look at it to help mitigate those three risks that we talked about earlier, which is the risk of cancer, the risk of decreased fertility, and the risk of the testicle twisting on itself and losing its blood supply and dying. Thank you.